School districts are having to make tough decisions about reopening, while the American Academy of Pediatrics strongly advocates the goal of having students physically present. Local schools are trying to figure out how to make it a safe environment for students and for teachers, and there are clearly two sides to this issue. So what is the right thing to do? Dr. Bindiya Gandhi is the medical director at Revive Atlanta MD, and we're pleased to have her join us this morning via Skype. Dr. Gandhi, good morning. How are you today?
Good morning. Thanks for having me today.
Well, let's start with the American Academy of Pediatrics. They've been very clear, but what are some of the main reasons that they are recommending that students be physically present?
Look, everybody is in agreement that students do need to be in the classroom, and the reason is because, they have better resources at school. Teachers provide them the better education. Parents are not taught how to teach their kids. Parents are busy. Those are all factors to consider. Online learning is still new. There's a lot of kinks in it. Some kids don't have access to computers or iPads or learning material where they would at school. Even when it comes to kids' lunches, kids are fed sometimes twice a day. And now with the pandemic, a lot of families have been affected. So nutrition is also important and can play a big role into kids' education. So there's a lot of reasons why, the American Academy of Pediatrics still recommends that ideally in a perfect situation, we should get our kids back to school.
All right, let's talk about the school systems from their perspective. Many local systems are going to start the year with virtual learning, maybe perhaps phase into some kind of a hybrid, or perhaps getting the kids fully back in school. What kinds of things do they need to consider, and what can they do to make returning to school safe for the students and for the teachers?
The biggest thing, honestly, is having a protocol in place. So knowing what to do if a patient or staff member does get COVID, and also implementing, having backup staff. That's very important. The other thing is making sure that there is some fluidity, because things are going to change from month to month as this pandemic gets better. Maybe it gets worse in the fall again. So there needs to be some fluidity. But the consensus still pretty much is having staggered class times, also having desks 6 feet apart, limiting the amount of students in a classroom versus having traditional 30 kids in a class. Also, maybe having outdoor classes, though that's important, making sure kids are wearing masks, they're sanitizing stations all over the school system, as well as making sure kids are able to, hand wash regularly. So all these things need to be in place and working efficiently to make sure that kids do this well when we are talking about integrating and having kids back in school full time.
Certainly need to consider the parent's perspective as well. You're a parent, I'm a parent, and because every situation is unique, what important considerations should parents take into account?
Parents honestly just want what's best for their kid ultimately, right? It's hard right now because a lot of parents are working from home. So it's hard for them to, teach their kids like they should and still take care of their work. So that's kind of important as a parent, trying to balance the two. This is why, teachers are taught best and they can educate our kids better. Teachers are also taught how to pick up on things like, depression or physical or sexual abuse or anything like that parents are not aware of. So, it's a hard decision by all means for parents to make whether or not we should send our kids to school. But things to consider as a parent, how healthy is your child? Does your child have any pre-existing medical conditions? Because if your child does, you're probably going to want to continue homeschooling or virtual learning maybe the rest of the year.
Well, since the beginning, there have been mixed messages about what precautions are necessary, what's helpful. There have been questions about the accuracy of numbers. Seems like much like a lot of other issues in our world right now, whether to return to school or not, it's become politicized. So can we cut through all of that? And as a doctor and as a parent, what do you think should happen?
Honestly, I think right now a lot of counties are doing kind of like delayed start virtual learning. I think that's wise right now until the numbers get better controlled. Now, when September, October hits, we'll reevaluate and kind of see where everything is. There's a lot of safety concerns. Parents don't want their child to get COVID. and with good reason. But also think about if a child gets COVID or maybe a carrier for COVID, because most kids are actually carriers. If they bring that virus home to the parents or to grandparents, how is that going to affect everybody and the family? So again, there's a lot of things to consider. If your family is high risk, it's probably a better idea for your child to stay home right now and continue online learning for a while. But if your child has a healthy, robust immune system and school is back opening, depending on the situation of the class sizes and making sure the schools are able to kind of implement these protocols in place, maybe it would be a good idea for your child to go back to school, especially if they do well learning in a physical environment. Kids need socialization just as much as adults do.
Tough decisions to be made. Dr. Gandhi, thank you for your time and for your perspective.
Thank you so much.
And for more information about today's segment, head over to our website, fox5atlanta.com, and click on the As Seen on TV tab.